So filaggrin. Okay. So filaggrin is a protein in the skin, and it's critical for maintaining the skin barrier. Low levels of filaggrin are a key factor in the development of eczema because this contributes to skin barrier dysfunction or that leaky skin. Now, there's a gene that makes this protein, and mutations in this gene can cause low levels of filaggrin. So that's not the only thing that can cause low levels of it, though. So inflammation and environmental things like skin irritants, low humidity, cooler temperatures, pollution, all of these things can lower filaggrin levels, even in people that don't have a mutation in that gene. So this means whether or not your child has a mutation, they still likely have lower levels of filaggrin, especially if they're struggling with chronic skin rashes, because this is inflammatory. So that inflammation lowers the filaggrin protein in the skin. So low filaggrin impairs skin barrier function because it increases the pH of the skin, and that makes it more basic. And remember that the skin pH is actually acidic. So as the skin gets more basic, that actually also allows things to overgrow on the skin, like Staph aureus and other pathogenic bacteria and things we don't want there. And then in turn, having more staph on the skin then lowers filaggrin even farther. Having lower levels of filaggrin also increases itching, and it can also increase allergen exposure because the skin barrier is more dysfunctional. So we can get those allergens through the skin sensitization through them more easily when filaggrin is lower. So this is where some of the other clues, like that your child might have low filaggrin, if like they have super dry alligator or elephant skin, high colonization of staph on the skin, irritated by water, those are signs where I'm like, okay, we're going to talk about that histidine supplement. I know many of you have asked about it already. But those are signs where I'm just like, yep, you need some histidine. So for filaggrin to work appropriately, it needs this amino acid, which is histidine. It's a single amino acid, and it's actually made by gut bacteria. It's in foods too, but it's made by our gut bacteria. And I find this so fascinating that in infants, this amino acid is essential, which means it needs to come from the diet because their bodies can't make it yet. And they can't make it yet because they don't have enough gut bacteria to do so at that stage in their gut microbiome development. So histidine supplementation can increase filaggrin, it can improve skin barrier function, and it can lessen the severity of skin rash symptoms, and like the itching and the pain and the weeping and the flaking. And a number of people have asked this too. I have not seen histidine cause problems in histamine sensitive people. So histidine and histamine are different. And yes, histidine can get converted to histamine in the body, but I really haven't seen that happen in my practice. And like I mentioned too, again, so among other clues, if your child has like that super dry alligator or elephant skin or high staph colonization on the skin or is irritated by water, they might have low filaggrin and might be able to benefit from increasing histidine. So something else that I think is really interesting is that the filaggrin protein in the skin matures in different areas at different times. So in the cheeks, it can take up to 7 years to mature. So if your child has facial eczema, this is a case in my practice where I will also recommend a histidine supplement for that person. But before you reach for a histidine supplement, include histidine-rich foods in your child's diet and yours if you're nursing. And starting with diet really is important because you can't out-supplement a diet that's lacking in the first place. So foods that are rich in histidine are protein-rich foods, so like meats and dairies and beans and legumes, fish, nuts and seeds, eggs, and whole grains. Now, I also, let's see, check the chat. Okay, I'm going to save some of those questions for a little bit later. Okay, so let's talk about histamine now. So, because this is a common question I get too, so I want to dive a little bit deeper here for you. So histamine is a substance that is released from specialized mast cells. These are cells of the immune system, and they are triggered often as part of an allergic immune response. So allergies and eczema, by the way, are two different health problems, But what happens is that the inflammation that allergies cause triggers the rashes and the flares. So most kids, or people in general, but children with eczema, I mean, a lot of them do have true food allergies, but most people with eczema actually don't have true food allergies, but they are at a greater risk for developing them, again, because of that broken skin barrier and that possible sensitization through that broken skin barrier. So back to mast cells. So mast cells are triggered as part of the body's natural, like normal response to injury or allergic, like hypersensitivity reactions. And these mast cells, they also store and release a number of other chemicals, like histamine is just one of them. But histamine is responsible for many of the symptoms that we get when we have allergies, like, the hives and the trouble breathing and the swelling and things like that. So with anaphylaxis, histamine concentrations in the blood raise really fast because they're normally low. But so they'll shoot up like within 10 minutes of the start of symptoms, and they should return to normal within like 30 to 60 minutes. So these are those immediate reactions. And I know a lot of folks are concerned too about something called like mast cell activation. This, along with mastocytosis, are really rare conditions and most often are not what's happening with your child. I actually have not had anybody in my practice that has actually had these things. These conditions are abnormal and inappropriate increases in mast cell proliferation versus like heightened responses. So typically what you're seeing is a heightened response, not abnormal or inappropriate increases in the number of these cells. And just because too that your child itchy or has allergies, it doesn't mean that they have either of those conditions. Back to anaphylaxis for a minute. So anaphylaxis is usually diagnosed just based on symptoms. And so we get like the difficulty breathing, the wheezing, itching, like hives, right? So it's not necessarily an eczema rash, it's hives. Also maybe lightheadedness or dizziness, low blood pressure. And then we get that swelling of the face, the tongue, the eyes, and reactions can be life-threatening. And so in addition to allergic reactions, though, histamine plays a role in normal, healthy inflammatory processes. Like we need it. It's a healthy immune response. It stimulates the production of stomach acid. It's really important for digestion. It acts as a neurotransmitter. So we need it for our neurological health. It dilates our blood vessels so that fluids can move through them. And it also impacts the contraction of like our intestines, our lungs, and our heart rate. So we really need histamine, and the body makes it, for all of these reasons. And so trying to lower it unnecessarily can cause a whole host of problems, especially long-term. And some people too, histamine-related symptoms might develop after eating histamine-rich foods, and histamine is in a ton of foods. And we're going to talk again a lot more about this in the Nourish module, but I'll just kind of preface it here because we're talking about histamine. But so my first thoughts about a low histamine diet. So if you can identify that your child reacts to a food, yes, it makes sense to keep it out while working on the root cause of the problem. But again, we're going to talk about elimination diets and how to stop the unnecessary diet restrictions next week. But if your child does eat a lot of histamine-rich foods and you think they might have a histamine or might be triggered by histamine, you can try to lower levels of those foods in the diet. It's impossible to remove all sources of histamine because it's in so many different foods. So like if they're eating a lot of foods, if they're eating a lot of high histamine foods, reducing levels of the ones they eat most often might be helpful. So it's like avocado and aged cheese and cured meats, fermented things, right? Including sauerkraut. Nuts and cashews, peanuts, walnuts, smoked fish, vinegar, spinach, bone broths are high in histamine, and of course, certain probiotics. And we're going to be talking a lot more about that too during this course. Also know too that gut microbes, like certain bacteria, do make histamine. And so I really find that if histamine is an issue, the primary reason is because of gut problems and overgrowth of certain bacteria in the gut that increase histamine levels. Because it's typically not that people can't break down histamine. So many people will start supplementing with like a DAO supplement to try to help. I have not seen that help. And the problem really is it's just their systems are so overwhelmed and they can't keep up with the extra histamine load that's coming in from the diet, on top of all the histamine that the body makes and all those that the gut microbes make, especially the dysbiotic ones. So on this slide, you're going to see what this is are some of the histamine producers that are found in the gut. And the GI map a comprehensive digestive stool test can help identify these. So if you've done a GI map for your child already and you see any of these guys present, could be contributing to some of their symptoms, especially the histamine related ones. And we'll talk about that again in the gut lesson too. But, and a way to address this is really to identify and address those gut imbalances and those problems. And just remember too, like, it's typically not that your child can't break down histamine. It's just that the system is so overwhelmed, so it can't keep up with that histamine load. Also, when it comes to the itch, it's often with eczema in particular, it's not histamine that's causing the itch that's associated with eczema. So inflammation in the skin and having the rashes and scratching and such, that inflammation triggers triggers the nerves that transmit itch signals to the brain. This is called proprioceptive itch. And so it's an itch that starts in those peripheral nerves in the skin, and it can be caused by an allergic reaction. But again, it can be caused by just damage to the skin, inflammation. So if antihistamines haven't helped with your child's symptoms, this is likely what's happening. And it's in cases like that where I would say if the antihistamines aren't helping, we don't really want to use them, because what they do is they really stop histamine production, like they shut it off in the body. And again, we need histamine for all of those things that I described. So if the antihistamines are not helping, forego them. If they are helping, with the itch, awesome. You definitely keep using them until we get through this with your child and get over the hump. If you're using them at night and maybe they're not helping with the itch, but they're helping sleep is really important. So that's another area where I'm like, okay, if your child isn't sleeping and it's helping with that, then I think that's another, a good reason to give them a try. Another source too of what can be causing the itch are the toxins from dysbiotic gut microbes. So this is aside from histamine also. So another thing, if like the antihistamines don't help with the itch, it might be that the toxins from the gut microbes are causing issues for your child.